Hi, good afternoon. Thank you very much, particularly to the mob in the front for that warm welcome. And thank you for attending. I know it's the last session of the day. My talk overall is quite brief, only about 10-15 minutes, because I know we've got an exciting evening planned. I am Dr. Krista Williams. I'm a Wiradjuri woman, a consultant dermatologist. I'm the daughter of Kevin Williams of Wiradjuri Nation, and I'm the granddaughter of Arthur Williams and Dorothy Grant, both of Wiradjuri Nation, who grew up in Cowra Mission, and like many of their generation, experienced the full brutality of Australia's racist and colonial assimilation policies. I acknowledge we're meeting on the unceded land of the Musqueam, the Tsleil-Waututh and the Squamish people, and that I live and work on the unceded land of the Wiradjuri people of the Kulin Nation in Naarm, Melbourne, Victoria. I acknowledge that I stand before you as a survivor of intergenerational trauma, as do all First Nations people. I also want to acknowledge the next generation of First Nations doctors, many of whom are in this row, in those front seats. And I wish to convey my deep pride in seeing you here today. I also wish to acknowledge and thank my mentors and supporters at the Australian Indigenous Doctors Association. I am the AIDA, the Australian Indigenous Doctors Association keynote speaker, and it is genuinely an honour to share my experiences and journey with you today. I'm a junior consultant. I fellowed almost a year ago, and there are so many complex things I could share with you. But today I decided to talk about where our health systems, racism, intergenerational trauma, and family violence interact. As with previous talks, please look after yourself first, and no offence is taken if at any stage you elect to leave. I also wanted to talk about pushing back against racism in our training programs and health systems, and holding these systems accountable when they do fail us. I also wanted to share how I overcame the most egregious racism I have ever experienced in my professional career, and built an award-winning, pioneering First Nations dermatology clinic, established within the belly of one of my country's oldest and most racist hospitals, and how this clinic is transforming how myself, my colleagues, my hospital, and even my training college provide specialist care to First Nations people. I was born in Lithgow, New South Wales, on Wiradjuri country, as the youngest of 3 daughters. My parents subsequently took in my cousins as kingship carers, and my family of 5 grew to 7 overnight. I was a clever kid, and I learnt the hard way how confronting it was for my high school teachers and peers, especially the white middle-class men at my school, to accept that a black woman was outperforming them academically. My high school experience was defined by my peers taking offence to my identity as a Wiradjuri Australian, despite my family experiencing the full brutality of Australia's racist and colonial assimilation policies. More than once, my family tree was drawn upon to show I wasn't really that Aboriginal in their thinking. My IQ did not start with me. It was a gift from my formidable and extremely intelligent grandmother, who was asked to leave Goolagong School at 8 years old, when it became white only due to parental complaints, and who fought that decision alongside her sister and her mother. Even then, access to educational equality was extremely important to my family. It wasn't until years later, when I was in university, now a medical student, that I realised the racism I experienced in high school came from my peers' absolutely inability to accept that an Aboriginal person, especially a woman, could outperform them in an IQ. Such is the pervasiveness of Australia's deficit discourse and that narrative when we talk about First Nations people. Not to be deferred, I subsequently completed my studies and became the first Aboriginal person accepted onto the Australian Specialist Dermatology Training Program. I I should say with great pride, there's 4 Indigenous dermatologists and 2 registrars, so soon there will be 6 of us. But for reasons extremely confusing to me, I was told that in order to accept this offer, I had to relocate and leave my friends, my family, as well as the hospitals that I knew, and travel to a state I had never lived in previously, as there were a few consultants sympathetic to First Nations people located in this state. Once again, my training experience was defined by a racist and colonial view that a few friendly consultants in a state I had never lived in before was more important than having the love and support of my family around me. It is a viewpoint my college has subsequently apologised for, and future trainees are no longer asked to relocate away from country or from family in the way that I was. Unsurprisingly, I was miserable in my new city, and when I heard about the opportunity to train overseas as an accredited trainee, I jumped at the chance. I practiced my interview at least 5 times and was awarded a competitive travelling scholarship to travel to Oxford for further training. It was the first time in the history of dermatology that this scholarship had been offered to an Aboriginal person. Perhaps the heart of British colonialism, Oxford gave me the opportunity to step outside of the Australian settler narrative, where my colleagues already held bias and preconceived notions of myself, and I got the chance to be just Crystal, a dermatology trainee just like everyone else. The experience was professionally so rewarding, and I stayed on 3 years, using the opportunity to travel Europe and enjoy all the adventures that came with it. But I knew there was racism waiting for me back in Australia, and ultimately I had to return and complete my training. And just as expected, there it was. Junior registrars, the North American equivalent of a resident, telling me I didn't look Aboriginal. Others looking me up and down, telling me diversity is important. But that didn't even compare to the systemic racism in my hospitals, in my training program, or from my supervisors. It's extremely distressing to me that First Nations people still cannot enter an Australian hospital and expect equality from our health systems or from the doctors and nurses that staff them. And this racism can lead to death, such as the case of Naomi Williams, whose name is used with permission from her Wiradjuri family, who was dismissed as a drug seeker and denied the antibiotics that would have saved her life and that of her unborn baby. For myself, this racism manifested when I went to my supervisor and I made an urgent and genuine disclosure of family violence that required me to travel home 12 months out from my fellowship exams to protect and support my family. I learnt the hard way how little my colleagues valued the life of my family members and how poorly equipped our hospitals are to manage disclosures of family violence. I allege I was denied my entitlements by my hospital, including the 20 days of family violence leave I should have received, as well as access to the names of the family violence contacts in my hospital. I allege I was bullied. I allege I was yelled at, called stupid, and had files thrown at me, and told genuinely but inappropriately that my exams are the most important thing. And never have I experienced such a conflicting worldviews that the well-being and safety of an Aboriginal woman and her child would be so devalued as to be less valuable than a fellowship exam. It's a worldview I still cannot comprehend, and such a bizarre response to a trainee disclosure that I'm still extremely confused, hurt, and disappointed by. I knew there was so much racism in our hospitals, but I still couldn't believe this was my colleagues, whom I had worked alongside as a friend and colleague, demonstrating this bias towards me. I can genuinely say no other non-Indigenous trainee would have been treated this way. Such is the pervasiveness of racism within our health and training institutions. But I promised you a story of how I held these institutions accountable, and eventually I did sit that exam. You know that exam. The exam that was supposed to be the most important thing. My performance in that exam was of such a standard that in an unprecedented move, the examinations committee wrote to me to inform that I had excelled well above the expected standard of a candidate sitting their fellowship exam. And they wrote to me to say they hoped that this gave me confidence moving forward in my profession. This was even more of an achievement because I did this while taking one of my training providers to the Human Rights Commission between my reading exams and my OSCE. Over a racist email sent to myself and no other exam candidate just prior to the exams. I also lodged a racism and bullying complaint against my hospital over their response to my request for family violence leave and support. So what do you do when your Indigenous-informed worldview conflicts with those of your supervisors? Everyone may have a different answer to this, but for me, the response was stay true to your values, your identity, your culture, and yourself. Having now sat and long finished that exam, I can guarantee you it is not the most important thing. I'm pleased to say, as a result of me standing up and lodging these complaints, every doctor in both my departments has subsequently completed family violence training, specifically identifying at-risk women and children, managing disclosures of safety and violence, and appropriately referring onwards. I've been told no other trainee will ever be treated the way I was in response to a request for family violence leave. And every supervisor on the dermatology training program is required to complete anti-racism or cultural safety training in order to keep our specialist accreditation. But I haven't even gotten to the best part, where the brutality I endured from my colleagues in response to my very genuine request for help and support has spotlighted bullying within my college, and subsequently previously silent trainees have come forward. It also inspired and influenced my decision to create a wholly separate and culturally safe First Nations clinic that provides both face-to-face and telehealth care to any First Nations person in Australia seeking specialist dermatology care. And by doing so, I have witnessed the clinic slowly transform the bias and the racism in my department, my hospital, and even my college. Myself and co-founder Gabrielle Ebsworth, Aboriginal Liaison Officer, who I invited as my guest to PRIDoC this year, have also witnessed other specialties outside of dermatology transform their interactions with First Nations patients. Towards a more empathetic, trauma-informed care model. Although there is still so much to be done in this space, especially in our large specialist hospitals. My hospital is expected to soon fund additional AHOs, Aboriginal Health Liaison Officers, to attend outpatient appointments alongside First Nations patients, using a model pioneered in our clinic. So I flipped the narrative as to why was I so inadequate as a trainee, to why was my college so inadequate as a supervisor. And by doing so, have gone some way towards improving the experience of future trainees, like those at AIDA, the Australian Indigenous Doctors Association, did before me. Family violence is a serious health issue, and it has profound physical and psychological effects. The evidence tells us that clinicians are often the first professional that a victim or survivor may make a disclosure to. In my state in Victoria, there was a Royal Commission that identified hospitals specifically as a missed opportunity for preventable death in the community. I look forward to progressing how we as doctors in hospitals value the lives of First Nations women and their children experiencing family violence, and accept that the evidence overwhelmingly shows us that to date our responses have been inadequate. and accepting that we do need to do better as a health system. Lastly, I wanted to talk about post-traumatic growth, which is a concept I'd never heard about before and was not taught to me in medical school. How the trauma of this experience, as well as COVID, forced me to rethink my priorities. It made me confront what I valued and what I did not, and ultimately led to my decision to marry my long-term partner, reduce my clinical hours to include more family time. Trauma may change you, sometimes indefinitely, but it doesn't define you, and it can lead to growth that you wouldn't experience otherwise. It's also part of the reason I'm more kind and empathetic as a consultant, and it's given me new perspective on the people and institutions that tried to limit and impose their worldview on me during my training in a way that other trainees and candidates hadn't been forced to confront. It's made me an advocate for trauma-informed care and challenged all those around me to address how we, as senior doctors and consultants, manage disclosures of family violence within our health systems. It's also brought these conversations out from the shadows into the light, where they absolutely do belong, so we may hold ourselves and our health systems accountable to a higher standard next time. I would like to acknowledge my family, my mentors, my funding partner for the clinic, VATRO, the Victorian Aboriginal Community Controlled Health Organisation, my co-founder, Gabrielle Ebsworth, and I thank you for your time.